Parkinson's disease can be treated both medically and surgically. Every one of us will put every treatment initially with medicines till we can maintain the quality of the life. When the disease progresses beyond a limit where medicines cannot sustain their quality of life, or if the drug effect is not sufficient, or if an individual develops side effects, then it's obligatory that we need to choose the surgical options. There are several neurosurgical options one can look at depending upon the age of the individual, the type of Parkinson's disease, and the predominant symptoms one is suffering from. So depending upon if there is a severe tremor predominant, we look at lesioning in the brain called thalamotomy, and if there is severe rigidity, a procedure called pallidotomy can be done, and this is done through stereotactic surgery, either a radiofrequency ablation or an ultrasonic ablation. The gold standard treatment today all over the world is the deep brain stimulation, wherein an electrode is placed into the subthalamic nuclei, and a very high frequency stimulation can alleviate or relieve the completely majority of the major symptoms of the Parkinson's disease, so that one can get on with life with a good quality. However, the target of the DBS can vary depending upon the symptoms. We have either DBS for the thalamus, DBS for the subthalamus, DBS for the globus pallidus nuclei, depending upon the predominant symptom, whether it is tremor, rigidity, dyskinesia, or a combination of them. Whenever there is a combination of them, the most popular target is subthalamic nuclei. And the technology has changed today. We have a sleek batteries that are available, which are placed on the chest wall under the skin, which is connected to electrodes and to a fine electrodes which are placed into the subthalamic nuclei. The moment the battery is switched on, you get the high frequency stimulation to the brain, which almost works like a pacemaker, and then that will relieve the shaking, rigidity, and make the individual work as usual. This not only has improves the quality, relieves the symptoms, also reduces the dosage requirement of the medication, so that the complications related to the drugs and the side effects will certainly come down, and one can lead a very good quality of life. Of course, the battery technology has changed now to rechargeable things, so that we need not replace the battery too. It can be charged where it is in the body itself.